Hi, I'm Emily Beauregard. I'm the Executive Director of Kentucky Voices for Health. We're health advocates, and we think it's really important that patients are able to understand their health insurance, use it when they need care, and know what to do whenever they face a problem. So today we're going to be talking about troubleshooting health insurance problems. Since health insurance can be really complicated and difficult to navigate, this module will focus on the problems many patients face when trying to use their health insurance and how to avoid or resolve those issues. Today we're going to learn about surprise medical bills, what they are, what causes them, how to avoid them, and finally, what you can do to help someone resolve a surprise medical bill. We're also going to learn how to help someone file an appeal or a complaint with their insurance company. Since there are lots of potential problems people can face when trying to use their health insurance, I'm going to start off by talking about surprise medical bills specifically. I think this order makes the most sense for a couple of reasons. First, surprise medical bills are a really big problem that affect 1 in 3 of us at any given time. And second, I think it's really helpful to talk about a concrete problem before we discuss some of the solutions. I wonder if this story sounds familiar to you. This person was in a focus group and was sharing a story about getting a surprise medical bill. They said, "I'd been getting shots in my back for 3 or 4 years at this one particular place. But this particular time, they decided to send me to a facility over in Indiana." And I'm going, okay. But then I get a bill for $7,000. And I'm saying, what? The facility was out of network. They didn't tell me. I said, I can't pay this. Look, I'd been getting it free because I'd been going to a clinic on Broadway. But if you don't ask, and he has an office over in Indiana, they may not pay for that facility. The facility was out of network, not the doctor, because I'd been seeing him for a couple of years. It took me probably about 3 or 4 months until I finally got a clear bill saying that I didn't have to pay that because, how was I supposed to know? How do you all know that? I didn't know to ask. He referred me. So that's just one example of a surprise medical bill. Privately insured patients assume that if they pay their premiums and choose in-network providers, their insurer will cover the cost of medically necessary care minus any deductible or copays that they might owe. But unfortunately, it's a lot more complicated than that, and patients can end up getting caught in the middle of disagreements between what the provider is charging and what the insurance company is obligated to pay or is willing to pay. So in this section, I'm going to explain the types of surprise bills that are out there, who's affected by these bills, how they happen, and what can be done to avoid them or resolve them. Simply put, a surprise medical bill is any bill in which the insurance company paid less than the consumer expected. These are sometimes the result of enrollees not understanding their coverage, but too often, surprise bills are the result of patients unknowingly using an out-of-network provider or being given inaccurate information or even out-of-date information. One thing to know is that a surprise bill is really anything that is something you didn't expect. So it could be for a service that you didn't think that you received, a provider that you didn't know that you actually had a service from, or it could be because you went to a facility that was out of network when you thought it was in network. So there are different types of surprise bills, and there are different ways that you can resolve them. So here are a few examples of common stories that we hear, common surprise bills that people receive. When I talk about surprise medical bills to a new group of people, I usually get a lot of blank stares at first until I start asking a few questions. Sometimes I ask, have you gotten a bill from a provider you didn't even know you saw? Or have you gone to an in-network hospital and still gotten hit with a huge out-of-network bill? Have you ever gone to the emergency room and then found out from your insurance company that you saw a doctor who wasn't employed by that hospital? These things happen all the time. And once people hear those questions or hear an example, they usually perk up and say something like that either happened to them or to a family member or a friend. And these bills can be astronomical, and they can really be financially devastating. So we hear these stories a lot. People often aren't given good information about what their plan covers, or whether all the providers that they're going to see are in their network. And when that happens, people can be faced, like I said, with astronomical bills, thousands of dollars in medical bills that they weren't planning for and that they honestly can't afford. So that's why we really want to help people understand how to use their insurance and how to avoid these surprise bills before it happens. So before we talk about what we can do to avoid or resolve a surprise medical bill, let's take a step back and learn more about the scope of this problem and who is affected by it. While surprise billing isn't a new problem, it's become a really hot topic in the news and in state legislatures in the past couple of years. There's even a federal bill now that's been proposed to try to address surprise bills. The problem is widespread, but there's a lot of variation throughout the country caused by different state regulations and by differences in the contracts between providers and insurance companies. A consumer report A consumer report survey conducted in 2015 found that almost 1 out of 3 people with private insurance had received surprise medical bills, and 1 out of 4 people got surprise bills from an out-of-network provider. Few of the consumers surveyed knew their rights or even where to go to complain. Other researchers have found that 14% of emergency department visits were likely to produce a surprise bill, as were 9% of hospital stays nationally. The risk is even greater for patients who are admitted to the hospital via the emergency department. In those cases, about 20% of patients who are admitted to the hospital after going to the emergency department were likely to receive a surprise bill. 20% of patients. This sometimes happens when a person goes to the closest emergency department without knowing whether it's in network first, but more often it happens when someone goes to a hospital that they know is in network, but they aren't told that the provider treating them in the emergency department doesn't work for that hospital, and that provider ends up billing them separately for out-of-network services. The insurance company usually blames the provider or the hospital for not contracting with them, and the provider or the hospital will blame the insurance company for not paying high enough rates. Not surprisingly, the patient is usually the one who gets caught in the middle and stuck with the bill. So now I'm getting a little bit ahead of myself by talking about what causes surprise bills. I'm going to go back and talk a little bit more about the scope of the problem. This map was published by the New York Times in 2016, and the darker the purple shading gets, the more common it is for people to get surprise bills. So if we were in a room together right now, I would ask you why you think surprise bills cut such a vertical path through the middle of Kentucky and our neighbors to the north and south of us. My best guess here is that it has something to do with the healthcare facilities that are near the Interstate 65 corridor. There could be other reasons as well, but 65 really does cut straight through that dark purple spot. The prevalence of surprise bills may also have shifted since this map was published in 2016, but I think one takeaway that we can learn from this is that this problem affects people differently based on where they live and where they get their health care. So to learn more about how Kentuckians are being impacted by surprise bills and other healthcare costs, we actually worked with a group called Alterum to survey Kentucky adults in 2018. Alterum surveyed about 1,000 Kentucky adults, and we found that nearly 1 in 3 privately insured Kentucky adults received a medical bill they were not expecting. Of these, 23% were charged more than they expected, 10% received a bill from a doctor they didn't expect at all, 3% were charged out-of-network rates when they thought the doctor was in-network, 2% were charged for services they did not receive, and 4% experienced something else that was unexpected. So you should see an image of the report on the right of the screen, and you'll be able to find this report in your resource folder. We actually have the data broken out by different regions in Kentucky, so you can see how surprise bills affect people in your region, as well as other affordability issues that they might be experiencing. Now that we know who's affected by the problem, let's figure out what's causing it. I've mentioned a few causes already, but we'll talk through these one by one. One of the primary causes is that provider directories are inaccurate. Even though consumers are locked into an insurance plan for a year, providers aren't. They can join or leave a contract with an insurer at any time. That means that if you select a plan specifically because it includes the provider that you want to see, that could change without notice. Provider directories can get out of date pretty easily, so they're really hard to rely on. Another issue that a lot of patients face is that they have a narrow network, meaning there aren't many providers to choose from, particularly specialists. In this case, you may not always be able to find someone who's in network that can provide the care that you need. Another issue is insufficient consumer disclosure. All this really means is that the insurer or the provider didn't give you enough information to make an informed choice. This can happen when you're shopping for a plan or when you're trying to understand what providers or services are covered. It can also happen when you're seeing a provider and don't get enough information about what a particular service or treatment is going to cost you. Two other major problems that have made surprise bills so common is that people often don't know their rights, and most states don't have strong enough regulations to protect patients from getting caught in the middle of the insurance company and the provider. Surprise bills always result in a cost that a person wasn't expecting. Sometimes it's being charged for a procedure or a service you didn't receive, or being charged by a provider that you never saw. Other times it happens because you unknowingly see a provider who you thought was in network and then end up being charged out of network. When this happens, you generally get what they call a balance bill from that provider. Basically, balance billing occurs when the insurance company only pays part of the provider's bill and the provider turns around and bills the patient for the remainder of the bill. If you see an out-of-network provider, they can charge you as much as they want. The problem is that oftentimes people have no idea they're seeing an out-of-network provider. Other times they may not have realized that a particular service wasn't going to be covered by their insurance company. But on this slide you can see that the total charge is $500. The plan, the insurance company, allowed or paid for $300. The balance is going to be $200, and that is what the insurance company did not pay to the provider. So now the provider is going to bill the patient for it, and it's now the patient's responsibility whether or not they got inaccurate information to begin with or not. So now let's talk about what people can do to avoid getting a surprise bill in the first place. First, you should find an in-network provider or hospital. And to do this, you need to check the directory. There's usually an online directory, and you should also call the insurance company just to be safe. I would also ask your provider to confirm up front that they accept your insurance for the services or the particular treatment that you will be receiving. All of these things will help you to know that things are going to be covered from the beginning. You can also ask for an estimate of charges up front. This would be asking your provider to say what they expect things are going to cost. Providers don't normally like to do that, so you may have to push a little, but you can also let them know that you understand this is an estimate. If something else comes up, you just want to be informed of that before they make a decision and end up charging you for something that you didn't know about or approve. And then the next thing that you can do is ask if there will be any other providers or facilities involved in your treatment plan. This is especially important if you're having some sort of procedure or a surgery. If you're going to a hospital, you're probably going to have more than one provider caring for you. So you'll want to know if there will be a lab involved, a pathologist, a radiologist, or an anesthesiologist. These are typically the specialties and the facilities where you're most likely to get a surprise bill. So you'll want to know all of that ahead of time. And if somebody's out of network, you need to request that you have an in-network provider, which may require having to reschedule an appointment. Something else that you should do is call your insurance company's nurse line before going to the emergency room or the emergency department. That way you can make sure that they think it's an emergency and won't say that this wasn't medically necessary. When you go to the emergency department, you should ask if the provider you see is in network before you get care. I realize that this isn't always practical. In cases of true emergencies, this is something that you probably aren't going to be able to do. But when you're going in for something like a broken arm, you can ask and make sure that they know you want to see an in-network provider. And document this in case you need to dispute it with the insurance company or the hospital later. Okay, now let's assume we've already gotten a surprise bill and need to take care of it. Without a law that explicitly protects patients from surprise bills, there's really no surefire solution, but we do have some options. The first is that you call your insurance company and your provider. You'll want to provide any documentation showing that you were informed the provider was in network or that a particular service or treatment should be covered. So if you have that documentation, keep it and you can present it at that point. You may also need to file an appeal with your insurance company. If your provider was truly out of network or a service or treatment was not covered under your benefit plan, you can try to negotiate a lower bill. That often works. If you offer to set up a payment plan or if you ask about some other way of discounting the cost of the total treatment, providers will often work with you. Now, if the bill is still not resolved, it's time to contact regulators. And by regulators, I mean the government. Self-insured employers usually have to answer to the U.S. Labor Department's Employee Benefits Security Administration. I know that's a mouthful. Other commercial plans, so if you are enrolled individually through, let's say, Anthem or United or Aetna, those plans answer to the State Medical Board and the Department of Insurance. All right, now that we've talked about surprise bills pretty in depth, let's talk more generally about what you can do if you experience other problems with your coverage. If your health insurer refuses to pay a claim or ends your coverage, you have the right to appeal the decision and have it reviewed by a third party. You can ask that your insurance company reconsider its decision. Insurers have to tell you why they denied your claim and ended your coverage, and they have to let you know how you can handle a dispute if you don't like the decision that they've made. The first step in filing an appeal is to really help either figure out yourself or help someone else troubleshoot a problem, is determining whether the issue is an appeal or a complaint. We're going to talk about appeals first. So what kind of denials can be appealed? You can file an internal appeal if your health plan won't provide or pay for some or all of the cost of your care, especially if it's things that you believe should be covered. And the plan might issue a denial for a number of reasons. The benefit isn't, it could be that the benefit isn't offered under your plan, or that they say it isn't, even though you dispute that. It could be that your medical problem began before you joined the plan, or that you received health services from a health provider or a facility that isn't in your plan's approved network. And again, that could be maybe that they changed mid-year, that they were in network and now they're out of network. It could be the requested service or treatment is not considered medically necessary by the insurance company, but often a provider will consider it medically necessary, and this is something that your provider can help you to dispute. It could be the requested service or treatment is considered experimental or investigative, and the insurance company doesn't want to cover that yet. So, and one more reason is that the insurance company may be revoking or canceling your coverage going back to the date that you enrolled, because they're claiming that you gave them false or incomplete information when you applied for coverage in the first place. So there are a number of reasons that you could either be disenrolled from your coverage altogether or denied some sort of coverage and be stuck with a bill. And these are reasons that you can file an appeal. So now let's talk about how you can file an internal appeal. There are 3 steps to the internal appeals process. First you file a claim, and this is really the step before you would make an appeal. But the claim always comes first. You or a healthcare provider will usually file a claim to be reimbursed for the cost of treatment or services. That's basically how health insurance works. You get a service, and then you want to be reimbursed for that. If your health plan denies that claim, then the plan must notify you in writing and explain why. Depending on what it is, they have 15 days if you're seeking prior authorization for a treatment. So this is actually a case when you haven't yet gotten the service. So you're not asking them to reimburse it. You're actually asking the insurance company to approve a service or a treatment before you get it. So they have 15 days to tell you why they've denied a prior authorization. They have 30 days to tell you if they're denying some sort of medical service that you've already received. So that would be denied paying for a medical service that you've already received. And then if it's an urgent case, they only have 72 hours to tell you why they've denied something. Now, if your claim is denied, these are the steps that you can take to file an internal appeal. First, you need to be sure to complete any forms that your health insurer gives you. So if you contact the company and say, I want to file an appeal, ask them what you need to do, if there are forms you need to fill out, and you're going to want to complete those. Another option is writing to the insurance company, making sure that if they don't have specific forms, and then you're going to want to make sure that you're including your name, the claim number, which you'll probably be able to find on the letter that they've given you denying something, and also your health insurance ID number, which should be on your health insurance card. Then you should submit any additional information that you have to help make your case. And this is often a letter from a provider that can state why this was medically necessary, why it should be covered, and if you also have any additional information about why you weren't aware that perhaps the provider was in network and then went out of network, you should also include that information. So one other important note is that you have to file this internal appeal within 180 days of receiving notice that your claim was denied. So if you have an urgent health situation, you can ask for external review at the same time as you do your internal appeal, but you have to make sure you do that within 180 days or 6 months. And then in terms of the timeline for this, your internal appeal must be completed within 30 days if your appeal is for a service that you haven't received yet. So that's typically when you're asking for that prior authorization for the insurance company to approve something that you need. Your internal appeal must be completed within 60 days if your appeal is for a service that you've already received. And this is typically when you've received a service and now the insurance company is saying that they're not going to pay for it. So that's the time frame that you need to be aware of. And if you need more help, you can contact the health insurance advocate at Kentucky's Department of Insurance. I've included the information on the screen. Every state has to have what they call a consumer assistance program. And this program is supposed to be able to assist people in filing appeals when they need extra help. In Kentucky, this is run by the Department of Insurance. And so if you call them, they should be able to help you file an appeal or tell you what you need to do. So now I'm going to go over tips for filing an external appeal. If you end up having your internal appeal denied, the external appeal is the next step. You're going to want to make sure that you have everything documented. So be sure to save original documents that you've received either from the doctor's office, from the hospital, from your insurance company, and then don't give those original documents to the insurance company. Keep those for yourself and make copies to share. Then you may need to provide specifically the explanation of benefits. Sometimes doctors or insurance companies call this an EOB. but it's an explanation of benefits or a letter showing what was denied. And then you will also probably be asked for a copy of the original request for an internal appeal. So whatever you first initially provided to the insurance company. Then you'll want to add any documents with additional information that would help you make your case. Like I said before, this could be a letter from your provider talking about why this service or treatment is necessary. You'll also want a copy of any letter or form that you're required to sign. So if you've had to sign something to give your approval, you're going to want to have a copy of that. And then be sure to note, have any notes or dates from phone conversations that you've had with your insurance company or with the provider or doctor related to the appeal. So in your notes, if you can think ahead about this, include the day, the time, the name, even the title of the person that you talked to, and any details that you can remember about the conversation. All of these things will help make a stronger case for your appeal. So let's say that your external appeal is denied as well. At this point, it's time to file a complaint. And filing a complaint in Kentucky typically goes through the Department of Insurance. And what you'll see here is information that I was able to get off the website for the DOI. They define a consumer complaint as something that is related to difficulty with an insurance company, an agent, or an adjuster. So they don't deal with issues related to your provider or to the hospital. They specifically deal with issues that you have with an insurance company, agent, or adjuster. So there are two ways to file this complaint. There's a paper form, and there's a link here that I've included for you, and there's an online form. The paper form can be downloaded, and you'll need that if you're actually assisting someone else in filing a complaint. So here are a few tips for filing a complaint that you should be aware of. You definitely need to include your name, your street address, not a P.O. box, you need a street address, and best daytime telephone number. You may get contacted for additional details, so you'll want to be able to be reachable. You should specify the complaint is related to health insurance because the Department of Insurance does deal with other types of insurance. So you need to make sure that you're saying that this is an issue with health insurance. You'll want to note the company and or the insurance agent that is involved in your complaint. You'll need to include information about your policy, the claim, the ID, or the group number. You can usually find these on your insurance card. And you'll want to actually have a copy of both sides of your health insurance card so that all that information is provided to them. And then include a detailed summary of your complaint with copies of any related documents that we've already gone over. And make sure, again, to send copies. Don't send your originals. So you can upload these through the online form, or you can mail these in if you use the paper form. And that information, the mailing information, is available on the paper form. So what happens after you initially file that complaint? After you submit it, you should watch for a written notice that your complaint has been received, and you should be getting a tracking number to go along with that. You need to save this and make sure to hold on to it so that you have it to reference if you do have to talk to somebody at the Department of Insurance. There's going to be a staff member assigned to this case, and they might contact you with additional questions or for more information. So that's why it's really important that you have that good daytime telephone number to be contacted at. And once your complaint is received, a copy of that complaint gets sent to the insurance company or to the company that the agent works for, and they are asked to respond within 15 days. The Department of Insurance notes that they are very strict with this deadline, and they also note that the majority of cases are completed within 30 days. I have no idea how many of these cases are resolved in a satisfactory way, but they do have a process for making sure that they're closing the loop and they're getting information back to you about what's been decided. And if you have additional questions, you should either reach out to the person that's been assigned to you, if you have a staff member, or call the 1-800 number that I've put on the screen and have your tracking number handy. So if you're filing a complaint on behalf of someone else, you have to do things just a little differently. You would need to use the paper form, and there's a link to that form again. On the back page, there's a section that would have to be completed by this other individual, unless they are unable to do so. And in that case, you would need a power of attorney or some other documentation to explain why this individual can't fill the form out for themselves. And again, in this case, if you have questions, it's probably best to call and talk with someone to work through those. But these are the steps that you can go through to try to address issues that come up with insurance in terms of either claims that are being denied for payment or services that are being denied altogether, or issues that you might have with a surprise medical bill. So I hope that's been helpful. If these different troubleshooting tips still don't work for you, there's one more thing that you can do. You can contact legal aid for assistance. Now, legal aid, of course, has limited resources. They are not in every single county, but they do have offices around the entire state. You can see those here on the map. And they will at least talk through the issue with you and try to figure out what you can do or if they can help you. And so we've actually put this map on our website, at Kentucky Voices for Health's website, and you can find more information there in terms of contact information and mailing addresses. And when you talk with somebody at legal aid, explain to them all of the steps that you've already gone through and what type of help that you're looking for. And at that point, they'll be able to help you determine whether there's something that you can do legally to address the issue. That's it for this module. So thank you very much for your time, and we look forward to hearing any feedback that you may have.